Today we will be discussing, just watch.
Welcome to this beautiful journey. It can be confusing at times, especially for a first-time mother. In this video, I will explain what to expect from the time of your first visit until your due date. Bearing in mind that pregnancy care varies based on the patient and the circumstances of the pregnancy. On your first visit, your doctor will gather information about your general health, order blood tests, perform an examination including a pelvic exam along with an ultrasound scan. The information will include history of previous pregnancies and any complications, any medical conditions you might have before pregnancy, and try to identify risk factors to provide the best course of action during pregnancy. The blood tests are important to assess your hemoglobin level and your blood type, along with screening tests for infections like HIV, syphilis, hepatitis, and assess your rubella immunity. If you have a risk factor for having a baby with chromosomal abnormality, your doctor might order a blood test called non-invasive prenatal testing. Ultrasound in the first trimester is important to determine the gestational age and your due date by measuring the length of the baby. This is known as crown-rump length. This is the most reliable way to conclude the gestational age. Sonograms also used to ascertain the presence of a heartbeat and determine the number of fetuses. Nausea and mild vomiting are common at the beginning of pregnancy. It is known as morning sickness, and it's a sign of a healthy pregnancy. There are several medications to treat this condition. Too much of it is called hyperemesis gravidarum and can lead to dehydration. If you think you are dehydrated or have any concern, consult your doctor immediately. It's not uncommon to have mild spotting occasionally and some discomfort. However, if those symptoms are severe, there is no harm in going to the hospital for a checkup. In the second trimester, you might start experiencing pain on both sides of the pelvis. This is known as round ligament pain. Or you might have pain in the middle part of your pelvis, exaggerated by walking. That's called symphysis pubis pain. Bleeding is unlikely in the second trimester, therefore you need to be very vigilant to any symptoms and contact your doctor immediately if you have any concern. A second ultrasound scan is performed during the second trimester called anatomy ultrasound scan. This ultrasound is used to assess different organs like brain, heart, kidneys, limbs, and other organs. Blood tests in this trimester include screening tests for spina bifida and chromosomal abnormalities like trisomy 21. This test is performed between 16 to 22 weeks. In addition, a blood test is performed to rule out diabetes in pregnancy called gestational diabetes. This is usually performed between 24 to 28 weeks. After 20 weeks, the height of the uterus in centimeters corresponds with how many weeks you are, plus minus 3 centimeters. This is called the fundal height. If your doctor has any concern about the growth, they might order an ultrasound scan to assess the fetal weight. At each visit, your doctor will listen to the baby heartbeat using a handheld device and make sure that you are up to date with your vaccination. Flu and COVID-19 vaccines are completely safe and can be given at any point during pregnancy. The Tdap vaccine is a triple vaccine that covers tetanus, diphtheria, and pertussis and is given after 27 weeks of pregnancy. After 36 weeks, a swab is obtained from the rectum and the vagina to assess whether the patient has group B strep bacteria. For more information, please see the GBS video. Notice that the ultrasound scan is not necessary in each visit unless it's indicated. Towards the end of your pregnancy, it is important to discuss labor. Induction of labor has certain medications and can be achieved by giving a small tablet called Cytotec or by giving an intravenous infusion called Pitocin. There are other mechanical methods like inserting a Foley bulb in the cervix. It is important to discuss the timing and what to expect if you are having an elective cesarean section. In the coming video, I will explain what to expect during labor, from the time of arrival to the hospital until you are discharged with your baby. If you want to see more videos like this, please like and subscribe, and I will see you next time. Have a happy pregnancy.